My name is Margaret Webb. I work for DEBRA Ireland. DEBRA is a support group for patients affected by a condition called EB. Its full name is Epidermolysis bullosa. A bit of a mouthful, so we just tend to call it EB. DEBRA was established some 20 years ago by parents of children with EB. At that time, caring for your children was a serious struggle. People would have to generally travel over to the UK for ongoing medical care. And the parents were motivated partly to support each other in caring for their children, but also to try and improve the treatment and work towards a cure for EB. So they came together and established a small charity, and that charity has been working now in the country for over 20 years. In that time, we have seen some major changes. EB is a rare condition, and since then we have been able to establish, with the help of a consultant, an excellent quality of care for our children in our national hospital. We have also been able to work, again thanks to the parents and supporters, and raise money to fund research into EB. Currently we are supporting research in Galway, in Dublin and in London, and we have also supported research in the States at Stanford. We are driven very much by trying to bring forward the day when there is a treatment for children with EB. It's going to come by stages, but we are also equally committed to helping parents and those affected by EB in living with the condition on a day-to-day basis. EB, if you don't know it, is a skin blistering condition. It will affect children and adults externally as well as internally. For some, it can be fatal in infancy. It can cause wounds, very much like burns, and the effects of these wounds are progressively disabling and extremely painful in their treatment. So one of the important things to do was to provide support tailored to the needs of the individual family. And we have a support worker who will go around the country and do what is required. Talking to her last week, she was telling me about what she did that week. One day she was working with a child who had lost a sibling to EB and doing some therapy in terms of helping that child come to terms with losing a young sibling. She had also gone off on a trip with an adult to enable that adult who is severely disabled to go off, have a break away from the family and time for herself, to be herself, away from the home situation. And our patient support is very much tailored to the needs of the individual and the family at any particular time. We do all of this with the support of the public. We receive very little government funding. And we are finding it, quite honestly, a struggle at the moment with the economy the way that it is. But we are driven by a passion to make a difference in the lives of those affected by EB, and by a drive that one day there will be treatments that will make an appreciable difference to living with the effects of EB as they are so severe. Right.